Hello, and welcome to WomenTalk, Beyond the Body, Perspectives from Real Women. I'm Luisa Santa-Coleman, the Education Director at Healthy Women, and thrilled to be your host for today. I'm here with Dr. Ariana Chao, Assistant Professor at the University of Pennsylvania School of Nursing and Medical Director at the Center for Weight and Eating Disorders at the Perelman School of Medicine, and an incredible group of women who have shared their stories with us about living with obesity, from growing up with a stigma to adopting body positivity. This is a topic that is very near and dear to my heart, having lived with obesity myself since a young age. To this day, I still have to focus on my health journey every single day. Whether or not this is a topic that hits as close to home for you as it does for me, I'm sure you'll find something to relate to in these 6 women's stories. Please feel free to join the discussion and ask questions in the comments section on Facebook and YouTube. Now I'd like to turn it over to you, Dr. Chow, to explain the continuum of care needed to treat obesity.
Thank you, Louisa. I'm really happy to be here today. As an obesity specialist who develops and evaluates treatments for obesity, I'm particularly interested in identifying how we can improve clinical care for this chronic disease. My research is focused on developing and implementing innovative treatment strategies for obesity and identifying subgroups of this disease so we can provide patients with more tailored treatments along the obesity care continuum. The care continuum includes support along an individual's journey, from diagnosis to initial weight loss to weight loss maintenance, as well as treatment with different types of tools to help people manage their weight. There are several tools that are available that have scientific support to help people with obesity improve their eating and physical activity behaviors and lose clinically significant amounts of weight. By clinically significant, I mean a loss of at least 5% of starting body weight. What this means is that for a person who's 200 pounds, we would want them to lose at least 10 pounds. While this might seem like a modest amount of weight losses of this size can help to improve a host of obesity-related conditions, such as blood pressure, blood sugar, and quality of life. The first part of the obesity care continuum is screening for obesity, weight-related comorbidities, and different contributors to obesity. Individuals with overweight or obesity who wish to lose weight should be offered intensive behavioral therapy, which includes counseling on diet, physical activity, and behavioral strategies. This type of treatment produces an average weight loss of about 5 to 8%. While behavioral treatment is effective for many people, it's important that treatment is escalated along the care continuum for people who have suboptimal results. Another important tool that we have is obesity medications. There are currently 5 medications that have been approved by the US FDA for chronic weight management. These medications target different biological pathways that contribute to obesity. For example, some might make you feel less hungry or feel more full. People who use prescription medications for obesity lose an average of 6 to 17% of their starting body weight. This amount of weight loss tends to be more in line with my patients' goals, and research has also shown that these larger weight losses are associated with greater health benefits compared to lifestyle interventions alone. People with higher BMIs of greater than 40 might be eligible for bariatric surgery. One of the most important points that I'd like to make is that one size really does not fit all when it comes to obesity treatment, and it's important that people have access to all of these different types of tools.
Thank you, Dr. Chow. Such great information. Now I'd like to introduce you to our health advocates, Keisha Calicut, Amber Hewitt-Garcia, and Pam Davis, so we can have a conversation about their journey in overcoming stigma and bias. Please make sure to continue adding your questions. And now let's take some questions from an audience. We've been collecting some of these questions that have come in this week. And for those of you watching, like I said, continue commenting your questions in the Facebook comment section. See. All right. So we have a question. So what has your experience been like living with obesity? And I guess I can go ahead and start it with Amber.
Hi. Thanks for having me here. Great to be here. I think living with obesity is like having television with static on in the back of your brain all the time. It's always with you. It it permeates really every facet of your life. So I think for years, while I'm in what is considered a normal BMI now, I've lost 245 pounds. And so it was everything from walking on an airplane to thinking about the chairs that would be at a cookout to shopping with a girlfriend, or just, and I think we'll talk a little bit about it, like just what is my doctor going to say when I go in for my earache and he tells me I need to lose weight. It's really just constantly being on guard that your body doesn't fit in, or it actually might be at risk of harm. So either like socially or physically. So I think it's something it's hard to turn off. It impacts every aspect of your life.
Absolutely. Thank you for sharing, Amber. All righty. A question from Caroline. Have you ever experienced bias or judgment from family or friends or healthcare providers while living with obesity, and how did you handle it? I think this is a question that we can all answer, but let's go ahead and start with Keisha.
Hi. Luckily, I have a supportive family who honors and appreciates and values me regardless of what the scale says. And my family has always been a safe space. However, that's not always been the case with healthcare providers. Excuse me. I remember one time I went in and just sounded terrible, just throat was red, tonsils swollen, and was just miserable. And when the PCP comes in, the first thing he says is, well, your BMI is XYZ. Didn't address me, didn't ask me how I was feeling or how I was doing. My BMI was the elephant in the room, so to speak. It was bigger than the actual reason that I was there. And I think that bias is actually embedded in obesity care. For so many people, the only thing that produces sustainable weight loss is medication or surgery. In one of my support groups, one of my friends has to show that diet and exercise doesn't work for 6 weeks before she can even be considered for medication. And that doesn't make any sense to me. So yeah, I believe that bias is embedded in obesity care management.
Can you talk a little bit about how you handle that, your visit that had nothing to do with your BMI, and kind of what was your response in that moment?
I didn't handle it well at all. It's like I clammed up and I didn't want to say anything. And while I was living with severe obesity, I often just avoided going to the doctor at all because I didn't want to hear it. I lived it. Nobody had to tell me that because I lived it. And so, yeah, I avoided healthcare.
Yeah, thank you so much. I think we can all relate to that. Before we move on to the question for Dr. Chao, Pam, would you like to answer how have you, focus on how have you experienced bias or judgment from family or friends or healthcare providers while living with obesity, and how did you handle that?
Well, I think what Keisha described is very commonplace in that it's, as someone with obesity, you carry your disease with you everywhere you go. And with other chronic diseases, they're not always visible. But with obesity, everyone can see it. Everyone knows that you have it. It often arrives well before you do, before you open your mouth, before you have an opportunity to really let people meet you and interact and engage with you. They've already formed an opinion. And I've gone for job interviews before where after I got the job, it was shared with me that one of the physicians was like, well, do we even need to interview her because of her size? Just things like that are so ingrained that I think a lot of times we just become accustomed to it. So it doesn't stick out to us as much as stigma or bias because it's become an ingrained part of how we live. And that's what I'm hoping that we can help change through the Obesity Action Coalition.
Thank you, Pam. This question is for you, Dr. Chao. They're wondering how we can support friends or family members with obesity.
Yeah, I mean, I think the most important thing to start with is really asking the person themselves. I mean, everyone is so different in terms of the support or, you know, what they need. So I think really having a conversation with someone, asking them, how can I best support you in your journey is sort of where it's really important to start. But I would love to hear other experiences from the other panelists as well, since they have more of the lived experience of it too. And I'm sure they all have different insights as well.
Yeah. What about for you, Amber? How do you think friends and family have supported you in this journey?
So I think family, that natural support structure, and like they're going to be on your side, like blood is on your side a little bit, is how I've always felt. But with friends, I think anybody that you know, maybe who wants to talk about it, or you sense they want to talk about their weight, is that come from a place of knowing that it is not a disease of choice, and that while there are a number of lifestyle modifications that you can make, you know, namely how much you move your body and what you put into your mouth, that can really matter and do matter no matter what other treatment options that you have, is that and see if there's anything that you can do. First, like, get consent that they want to have this conversation, get them enrolled in it, right? Like, don't just say, hey, time to talk about your weight, friend. But is that make sure that once they're ready to have that conversation, say, like, is there anything that I could do? Like, hey, my friend Amber, you know, she's really involved in the OAC. I can see if she knows any doctors in the area. Because a lot of times we can find physicians across the obesity treatment spectrum. But like the real thing we want to know is, like, is this person going to be a jerk when I walk into their office? And like, that's not in a database. That's not on like Good Doc or whatever. Or like 3 stars for being mouthy. I don't know. So we have to do that peer to peer. And so finding folks who will help you seek out medical providers that are kind and use evidence-based obesity treatments is something you can definitely help your friends with, and say, oh, here's everything that I know, and help them with the resources. So it doesn't feel so daunting, right? Because there are so many options out there now that are great. But for so long, we had snake oil.
Yeah,
and so separating
absolutely.
that out and finding someone that they can speak with that's going to treat them with dignity and respect would be a huge help as a friend or a family member.
I agree, Amber. I think it comes down to what Dr. Chao said, right? Just making sure you first ask the question. Don't make those assumptions. We have another question. As Amber said, living with obesity can be mentally exhausting. How have you focused on your mental health, and how important is it to find a community of people to support you? Keisha, do you want to start?
I actually am, I run a support group. So that has been really, really helpful. We haven't been able to meet in person as much because of COVID, but you know, having people who understand your experience, understand what it's like to be afraid to get stuck in a shirt in the dressing room. It's a terror that only those who've been through it can understand. So I love my support group. I love my friends. I love the OAC.
So it seems like a community of people to support you is really important.
Absolutely.
What about for you, Pam?
Well, so you gave me a little bit of a flashback there, talking about getting trapped in a shirt. Hashtag been there, done that. I too. So I work in an obesity treatment program, and we have virtual support groups that meet twice a month. And, you know, I've been doing this for years and years and years. But as a patient, I learn something new every single time I'm involved. And I'm not sure that I would have had that level of support through any other form of treatment. And it's just huge. There's nothing to replace that been there, done that component of talking to like-minded individuals.
Absolutely. Thank you. We have another question from Megan. Hi, Pam. In your video, you mentioned that trying to get to the standard goal weight based on the BMI chart is an unreasonable goal. What is your perspective of a healthy weight for you?
So the one that you feel the best at, the one that your body allows you to do the things that you want to do, to be able to move freely, actively, independently. And for some people, that's going to vary a lot. For me, we've been moving houses the last week, and I'm just like grateful every day that I have enough energy and mobility to be able to carry my precious coffee mugs up and down the stairs.
Yeah, absolutely. Thank you so much. And I'm guessing this question is probably for you, Dr. Chao. So do we know if the disease of obesity has genetic roots?
Yeah, so there's been a number of studies right now that have identified that there are genetic components to obesity. We know that obesity does tend to run in families, and that if parents do have obesity, then it might heighten the risk that a child has obesity as well. That being said, we know that there's a lot of different sort of gene environment interactions that can happen as well. So it's what we call a multi-genetic disorder, polygenetic disorder most times, where a number of genes might sort of influence someone's risk factors for developing obesity over time. But yes, there is the genetic root to it as well.
Thank you, Dr. Chao. And I also want to thank the three of you for being on this panel. Thank you so much for all your answers, all your open, vulnerability. We really appreciate it. Now we're going to introduce our other three health advocates. We have Jamie Fivecoat, Michelle Tedder, and Crystal Hartman, so we can have a conversation about advocacy and finding a supportive community. As I said before, please feel free to join the discussion and ask questions in the comment section on Facebook and YouTube. Hello, ladies. How are we all doing?
Doing good.
Good.
There we go. Hi.
Oh, same thing happened to you, just like me in the beginning. It's okay. It's all part of the fun. All righty. So question from Lori. How does one start their obesity journey and continue it? Feels like one step forward, two steps back, always. It seems like this very much resonates with all of us. Would you like to start, Jamie?
Sure. I tell you, you'll probably be restarting, like you were just saying, over and over again. And it is one step forward and sometimes two back. I think somewhere along the line somebody mentioned set point, and so that keeps driving you back up, which says we need to get to a place where we want to be comfortable. I think what's the most important thing is to find a care team, and because it takes a whole team to make it work for you. So when you are ready, because food has some addiction type of issues, and so when the first step is being motivated, when you're motivated to do it for yourself, and so when you get to that place, then it's finding that team, because you'll probably need somebody to work with as a counselor, and you're going to need a physician, depending on which type of treatment area that you're going to utilize. Then that will determine whether or not you need a physician that's going to help you with medications, or a surgeon that's going to help you go through the surgical processes. And then they will then include other members on the teams, like the nutritionists and exercise folks. And so it really does take that team to make it. So that's, to me, how you get started. And then you need support through to keep you going afterwards.
Absolutely. It seems like finding your personal why, not anybody else's, is so incredibly important in that beginning of the journey, isn't it? And then, of course, the community.
Yeah.
Thank you, Jamie.
Thank you.
Let's see if we have any more questions. Where are you in your journeys now, and what is most important? I'm guessing, during this journey. So let's go ahead and start with Michelle.
So that's a great question. I say that, one, a journey is something that's continual, right? When you take a journey, you don't expect it to necessarily end in a particular spot, or maybe you do, but with the obesity journey, it is a consistent kind of a path. And so you have to understand that it's not a destination that you're going to reach. You have to understand that it's going to be something that you're going to be working on, you're going to be tweaking. And just like if you get in the car and you start on a path, and let's just say you decide, I'm going to travel from the east part of the country to the west part of the country. Along that journey, your GPS is going to say, we're redirecting your route because you may come, you may come along some detours. Well, that's what this journey is like. And so I would say that for myself, I've just come to accept that I'm on this path for the long haul. I'm in the phase of just accepting that this body is perfectly imperfect. It is going to be that. And this journey is perfectly imperfect, and that's okay. And
Right.
so just like any other journey, I would hope that if we were traveling across country, we would take time to stop and see all the beautiful sights along the way. And so that's what it is that we can do on this journey through obesity, is that not be so critical of ourselves and have the self-compassion to know that it is just that, and we can enjoy the ride and we can tweak it, and we get to decide what that looks like along with the village that we create to help us.
Absolutely. Lifelong journey indeed, and celebrating the little things along the way, right? Those little victories. All righty. We have a question for Dr. Chao. For people who may not understand how or why obesity is a disease, I think this is somebody else asking it. Is there something else that you would want to add to someone who has maybe never lived with obesity, has never known anybody that has lived with obesity? Do you know, or what would be I would say, the easiest way to explain, yes, this is a disease, just like any other disease?
Yeah. So we have learned so much more about the physiology of obesity, which has really shown us that this is not a lifestyle choice. It's not a matter of sort of just calories in, calories out, and willpower and discipline. It's really so much more than that. Individuals with obesity can have different sort of impaired biological pathways or hormones that can really interrupt different signals for things like hunger or satiety, how full people feel. And because of this, there can be challenges with losing weight. And that's sort of, as someone mentioned before, with the set point, actually, when people start losing weight, there can be increases in things like our hunger hormones, decreases in our fullness or satiety hormones. And this can really sort of be driving up weight and really pressuring people to regain weight over time. So I think that the classification of obesity as a disease has really helped to start conversations about decreasing stigma and really bring attention that this is a chronic disease that deserves serious treatment, and that people should really be offered the spectrum of obesity treatment, ranging from lifestyle counseling, pharmacotherapies, as well as surgery.
Absolutely. Accessibility to different options, as you said. One size does not fit all, right? Alrighty, another question is, how do you find a supportive healthcare provider or team? Crystal, do you want to go ahead and answer this?
Yeah, sure. This can be a challenge. So, and we heard from some of the ladies before about finding those supportive healthcare providers. And, I had a situation where I didn't have a supportive healthcare provider, and it was my primary care provider. And she would say things like, you're young, you're, educated, you work in the healthcare industry. You should be able to control this. If you would just, eat a little less, walk a little more, you'd be able to lose this weight. And that actually really held me back from getting the care that I truly needed, because at 14 prescriptions for all of my comorbidities of obesity, I was just getting sicker and sicker. And it wasn't until I worked with my endocrinology specialist who said, all right, I'm on this journey with you. We're going to try all the things, right? And I think it's important to understand that there's a lot of different tools in the toolbox. And, some of them have been spoken about, just now, but I think, whichever ones you need a healthcare team that's going to keep an open mind and that's going to support whatever tools that you need. Oftentimes we can talk to our support group members or fellow members of Obesity Action Coalition. There's even a Find a Doc, link there to find obesity specialists. So there's definitely some resources out there, and it's absolutely critical to the journey to make sure your care team is on board and with you all the way.
It seems like sometimes it's so much trial and error, isn't it? Of sometimes you just have, or a lot of times, at least in my experience, is having a lot of providers where you don't feel heard and you don't feel like there's empathy. And often the focus, as we were saying, is that BMI and nothing else, even if you're going in for something, your foot, So I feel like that has been very much your journey and that trial and error.
Yeah, for sure. And it's also important to make sure you find the right mental health care provider, because that's an important part of your care team. For everything that you're doing to try to change your body, one of the hardest things to actually change is this, our own brain. And so making sure that care team involves a mental health care provider is also very important.
Absolutely. Yeah. It takes a whole community. Alrighty. For each of the panelists, what was the aha moment that led you to start your obesity management journey? Let's go ahead and start with Jamie.
Yeah. For me, it was just before I had a Roux-en-Y gastric bypass surgery. Was at that stage where I knew I had to do something that was going to be more drastic. And what really led me there was my doctor telling me that I was going to have to go on high blood pressure medication. I was already on cholesterol medication. I was on gastric reflux medication, and I was diagnosed as pre-diabetic, meaning that probably within the next 5 or 6 years from there, I would be on diabetic medication. So I knew that I had to do something. Fortunately, the result was that I got rid of those comorbidities. And so I've no longer take those other 2 medications, and I avoided the high blood pressure medication and never became diabetic. So it works, but that's what prompted me to do it.
Wonderful. Thank you, Jamie. What about for you, Michelle?
2 significant things happened in my life. In 2000, my mom passed away suddenly of a massive heart attack at the age of 71. We were very close, and it was horrible. It was devastating to me. A year later, I was diagnosed with type 2 diabetes. And so it was those 2 milestone things that happened in my life that made me say, I have to do something different. And so I think that laid the groundwork for me to be open when my primary care physician introduced the idea of weight loss surgery, because I'm not sure that I would have had the open-mindedness to consider that as one of the potential tools to help me to lose the weight, because I was still caught up in the mindset that it was my fault and that I just needed to exercise more, eat less, these things. But it was those 2 things that were so significant, and that I knew that if something didn't change, I could die early too. And I didn't want it to be the case for myself.
So definitely 2 life-changing events, Michelle. Thank you for sharing. And I'm sorry for your loss, of course. What about you, Crystal?
Yeah. So I found myself in my early 30s, and I was, like I had just mentioned, I was on 14 prescription medications. I was exhausted all the time. It was all I could do to come home and fall onto the couch, and I had 3 little boys at home. And I just realized that was not the life that I wanted to be living. I wasn't able to be the mom, the wife, the daughter, the, employee, all of that I really wanted to be, because I was just continuously getting sicker and sicker. I'd been hospitalized twice that year from obesity complications. And it really just woke me up to the fact that I needed to make a major change. Here I was 33, 34 years old, and I had a BMI that was in the morbidly obese category.
Right.
And that, that combined with wanting to make sure that I was around as long as possible for my kids was a huge factor for me.
Absolutely. Very, very great motivation. Last one is from Elena. Hi, is there any advice you can offer when you feel you're hitting obstacles, plateaus in your obesity management journey? I think I'll direct that actually to Dr. Chao.
Sure. I think one of the first things that I would recommend as a healthcare provider is reach out to your provider team and support team to see if there's any additional things that need to be adjusted, or sort of for that accountability as well as that support. So that's sort of my first answer.
Yes, absolutely. Thank you so much. We're actually now at time, but I want to, of course, thank you all for an amazing conversation. Thank you all for being here, for just being such an attentive and engaged audience. For those of you who haven't seen these lovely ladies' inspiring videos yet, please make sure to watch them on Healthy Women's social media channels. The landing page is linked in our comments section. Of course, thank you, Dr. Chao, for taking the time out of your busy schedule to share your expertise with us. And of course, thank you to our 6 guests for sharing their stories and experiences with us. Also, a special thank you to Novo Nordisk for supporting this event and our Reclaim Your Wellness campaign. Thank you to our partners, the Obesity Action Coalition and the Black Women's Health Imperative. And we'll see you on our next episode of Women Talk.
Thanks for joining us for another episode of Women Talk. Stay tuned for more Healthy Women Live events at www.healthywomen.org. You can also follow us at Healthy Women on Facebook, Twitter, and LinkedIn. You can also follow us on Instagram at healthywomen.org. We'll see you next time.